Hi guys, welcome to Memo's tutorials. Today we are looking at infectious or communicable diseases, and we'll start off by talking about malaria. So you need to know the causative agent of malaria, you need to know the signs and symptoms, and also the lifestyle of the parasite that causes malaria. It's very important to know the lifestyle. Once you know the lifestyle, you'll be able to you will actually be able to prevent it, to avoid it, and find ways of not being affected by it. Okay, so the causative agent, it's a protozoa, and its name is Plasmodium. And this Plasmodium is found in a female Anopheles mosquito. The signs and symptoms, they are not limited to these ones. There's fever, there's loss of appetite, headache, vomiting. There are quite a lot. You just need to master them as well. You need to know the difference between signs and symptoms. Remember, we said a sign, it's something that we can measure, it's something that we can see with our naked eyes. Not necessarily with our naked eyes, like temperature. We can measure your temperature, we can measure your body weight, we can see a rash, things like that. But then symptoms, it's most of the things that you tell us. For example, I'm having a headache. We cannot see that someone's having a headache, or someone is having a stomach pain, or aching joints. We cannot measure that. It's something that we hear from you as an individual that will be affected. So now, on the life cycle of this parasite, it exists in your body, and it also exists in the mosquito's body. So inside of the mosquito now, I want you guys to take note of this. Inside of the mosquitoes, we have saliva, and in the mosquito's mouth, that saliva, it contains Plasmodium. So this Plasmodium, when it enters now, when the mosquito bites you, what it first does, it's going to inject its saliva into your system. The reason being, its saliva has got chemicals that will stop your blood from clotting, so that it can suck your blood nicely. After it has done that, right, it will suck your blood nicely and go. But it's very unfortunate that if it is containing Plasmodium, you'll be left with Plasmodium in your system. And when that Plasmodium enters your system, it's going to target the red blood cells. When it gets inside your red blood cells, I hope you guys still remember what red blood cells are for. They carry oxygen around your body, right? So if you tamper with them, your oxygen transportation has been tampered as well. So when they get inside your red blood cells, they are going to divide there. Asexually, remember we did asexual reproduction. They are going to divide asexually inside your red blood cells, and they are going to develop and grow, and then they are going to rupture your red blood cells. They are going to rupture, and a lot of the plasmodiums are going to be what? Of the plasmodium cells are going to be released. And as they are released, when a fresh mosquito bites someone who is infected with infected blood, they are going to what? To suck it in. They are going to suck in the Plasmodium. And this Plasmodium, what it does when it gets inside a mosquito's inside the mosquito, when it gets inside the mosquito, it's to go inside the mosquito's stomach, and inside the mosquito's stomach, it's going to reproduce sexually, and then it's going to stay in the saliva there. Stay there in the saliva. That's how it keeps on passed from one person to the other, from one person to the other, from one person to the other, like that. Okay, so this parasite relies on humans and mosquitoes. That's very important for you to know. It has a lifestyle inside a mosquito stomach, and a lifestyle inside a human, right? And what does it affect mostly? You must know that it affects your red blood cells mostly, than any other part, right? And the other thing that you need to take note of is that the parasite affects your liver, you know, and it's going to reproduce rapidly in your liver as well. It's going to reproduce rapidly in your liver, meaning to say it's going to remember, it's in your body, it reproduces asexually. More of these parasites will be formed in your liver. Okay, so that was it on malaria. Now let's have a look at typhoid. So this one is also caused by a bacteria, and it's a Salmonella typhosus. At least I can pronounce this one, right? It's the Salmonella typhosus. So this is very common where there is poor sanitation and people, they don't have any access to clean water. So this bacteria, it lies in people's intestines. So mostly it is moved from one person to the other through contact of feces with the feces of an infected person. So if there is no good sanitation, someone with typhoid relieve themselves anyway, and their feces get into your water or your food, you get typhoid, right? So now, eating contaminated food or drinking contaminated water, you'll get this disease. In other terms, okay. So the signs and symptoms of this typhoid, it's high fever, stomach ulcers, headache, diarrhea, poor appetite. You know, it's quite a lot. You might also have a rash, you know, as well as a white coating inside the mouth. It's quite a lot of things. And then we have treatment. The good thing about this one, it can be treated using antibiotics. You know, I struggle pronouncing these antibiotics, but just know that these antibiotics, what they do, they kill salmonella bacteria. You have to know that antibiotic, by the way. So, and also rehydration helps. Remember, when you have diarrhea, you are losing a lot of water, right? So rehydration works. It brings you back to life. It brings back the balance in your body. And then now, how can we control the spread of typhoid? You know, it's very important that we practice good hygiene. You make sure you cook your food thoroughly to kill any bacteria if there is any. You drink safe water and clean water all the time. If you don't have any access to tap water, you can actually boil your water. Boiling your water kills any bacteria, and then you can drink it, right? Proper sanitation, you know, make sure that people, where they go for their number two, it's not gonna affect other individuals, as in people won't be in contact with any feces, no matter what, right? And then you must avoid traveling to places where they are at high risk of typhoid. Avoid traveling to places like that. And you must also avoid eating raw fruits and vegetables that cannot be peeled, especially when you are at places where there is a high risk of typhoid. You must avoid eating such foods. You rather stick to things that you can peel than fruits that you can that you eat directly. Okay, now let's move on to cholera. So cholera is related to typhoid in a way that it is also transmitted through eating or drinking contaminated water. So eating contaminated food, okay. So now, to avoid cholera, just like typhoid, we need to practice good hygiene, right? Proper sanitation. You make sure you cook your food thoroughly. You can also get vaccinated and even avoid places where they have a high risk of cholera. Always drink safe water. Boil your water before you drink it. And also, just like typhoid, when we treat cholera, we treat it with tetracycline, which is an antibiotic. At least I could pronounce tetracycline, okay. And oral rehydration therapy is very important. We usually call it the salt and sugar solution. just to bring back balance in your body. You need your water, your ions, then also needs to be balanced. So the oral rehydration helps you. Remember, like I said, the signs and symptoms that are like the ones for typhoid. The person will be having diarrhea and also vomiting, so you are losing a lot of fluids there. So when we rehydrate, you are simply trying to balance back your fluids. And you are also required to know the causative agent of cholera, which is a bacteria, and its name is Vibrio cholerae. Okay, so that's all that you need to know on cholera.